You are Canada's leading social marketer. How is this field managed and applied in your country?
So social marketing has been used in Canada since the early 70s. In fact, social marketing was created in 1971, I'm sure, by Cutler and Zaltman in an article. Canada in the 70s launched national social marketing initiatives, especially Health Canada, the federal government Department of Health, and an organization for which I worked at the time in the 80s. Actually, I was younger in the 70s, but Participation, which was a national health promotion, fitness promotion agency. So that's, it started early, so Canada is an early adopter of social marketing. In the 80s and 90s, it continued to be mostly used at the national level, but increasingly also in the environmental field. So not only public health, but also environment. And I would say during the last 10 to 15 years, a growing number of people are referring to social marketing not only at the national level, but also and mostly at the local level. And people in Canada, such as Doug Mackenzie-Moore, created the community-based social marketing. Health Canada with Jim Mintz, another great Canadian social marketer, did a lot to educate and train people. So now across the country there are a number of universities giving social marketing courses. It's being used in public health, environment, but also in other fields like the elections, housing, and a number of other issues. So it's still growing, but we still need to learn and grow.
Thank you. The second question. You are in Italy to teach social marketing to our health professionals in Emilia-Romagna. Do you find differences in the application of social marketing in Europe and more specifically in Italy?
The short answer is no. I think by definition social marketing adapts to audiences and context. So the process of doing audience analysis and the process of taking into account the context is very similar. Obviously, the manifestation, and I would add to that the apprehension towards social marketing are very much the same. Many people don't like the idea of you referring to marketing as a strategy for social change. So I have the same apprehension everywhere I go in the world. There's also apprehension around segmentation. And pretty often people don't like segmentation here and elsewhere because they think it's exclusion when it's really taking into account the uniqueness of segments. And there is always and everywhere a tension between focusing on behaviors or focusing on the community. So I see that everywhere and it's very similar. What I think becomes interesting is for me teaching in Italy is to appreciate through you and the participants in my course the unique dynamics of the community level, the campanile mentality, as well as the role of the various partners in civil society. That is rather unique, and every country has a civil society, or at least democratic country have a civil society. But how it plays and the respective role of the public sector, the non-profit sector, the private sector, the philanthropic sector, there the dynamics are unique and different.
Third question. Advocacy, social marketing, health communication. What are the most relevant differences?
Okay, well, social marketing is about, as a goal, normally we pursue behavioral change or societal change objectives. And ultimately, social marketing is about understanding the dynamics and the factors that would lead to behavior adoption or adoption of a policy. And we also, in social marketing, believe that it's not just through communication that we can achieve that. That in fact, the reason why people would adopt a behavior or do not adopt a behavior would have to do with environmental factors and context. And so a social marketer social marketing design strategy that includes communication but also deals with product, price, place type of strategy. So creating the conditions, not talking but doing things to make the behavior more attractive and easy for people. Health communication is the promotional aspect of a social marketing strategy. And it helps be very effective at designing communication and exchanging information with audiences to highlight the benefits of a behavior, but also sometimes to communicate to stakeholders what they can do to create the conditions. So communication is this exchange, production and exchange of information and other things to convince and persuade and inform audiences about what's desired. Advocacy is a form of health communication in order to convince a decision maker or an institution to adopt a policy or change practices that contribute to the health goal or the social marketing goal. So it's a little bit like Russian dolls. Advocacy within health communication within social marketing. And they all play a role, and ideally we want to do advocacy as part of a social marketing campaign. We obviously will use communication, but we'll go beyond just advocating and communicating.
Last question for you. What are the ethical implications of using social marketing in health promotion?
Ethical considerations, first of all, a lot of people think marketing is just about manipulation, and manipulation is bad. And of course it's bad. And if marketing equates manipulation, it's not a good idea. Marketing is not about manipulation. In fact, when it's well done, it's actually taking into account the audience and the citizen's perspective and impose on us to make the adjustment necessary to meet their needs and wants. So from an ethical point of view, one could argue that, in fact, marketing is more ethical than experts imposing on people what they think is desirable. In practice, then, I often summarize ethical consideration around three key ideas. Ends being pursued, means used to achieve the ends, and the actual consequences of our interventions. So the ends being pursued could be good or bad. Normally they're good on paper from a public health point of view, but maybe the reality of why we do something is questionable. The means being used to achieve our ends could be good or bad or questionable. And we often face the ethical dilemma of the ends would justify the means even if the means are questionable. Well, from an ethical point of view, we need to think twice. An example of that is what you decide not to say in a social marketing strategy because you think it would be counterproductive. Are you exaggerating benefits in order to get people's attention? Are you underplaying disadvantages so that people would value more? So those are the types of ethical dilemmas. And the last would be the consequences. And in ethical dilemmas around consequences, what would be the unintended consequence of your intervention? Doctors often say, first do no harm. Well, it's true in social marketing. The last thing you want is introduce an intervention that would lead to negative results. And hence, it's so important in social marketing to constantly do evaluation, not only to monitor success, but to monitor unintended consequences and make proper corrections when needed. And that would be an ethical behavior.
Thank you, Francois.